Good morning. I'm Russell Myers, CEO of Midland Health. This is our COVID update for Thursday, August 12th, 2021. I'd like to begin by thanking Dr. Kit Bredemus and Dr. Larry Wilson for handling this briefing last week. They did a fine job, and I do appreciate them stepping in my absence and doing very good work keeping the community informed. You'll hear from both Larry and Kit in just a moment. We are still in the midst of what I've chosen to label as the fifth COVID surge or spike. People are counting them in all different ways, but I think this is number 5. It is affecting Midland and really the entire country. I was looking at a nationwide heat map of COVID activity yesterday, and there's only a couple of states that are not bright red on that heat map. All over the nation, we're dealing with this unprecedented spike driven by the Delta variant. Starting off with data here at the hospital, we have a census as of midnight of 203. That's a continuously changing number, as we are, for example, right now holding 16 patients in our emergency department awaiting beds. The longest of those has been there for 21 hours waiting for the appropriate bed upstairs. The COVID situation is worsening, as it seems to do every day. We have a total of 75 COVID patients in the hospital, 42 of those in medical beds, 18 active and 3 convalescing COVID patients in critical care, 4 in progressive care, 1 in pediatrics. The story in pediatrics is important. While there's only a single COVID patient there, we are all but full on our pediatric unit. There's 1 bed available as of a little bit ago, which we think is about to be taken. That's being driven by other things, mostly RSV, the common respiratory virus that tends to happen in the wintertime, happening a little earlier this year. But pediatrics is very busy right now. Holding in the emergency department, there are 7 COVID patients of those 16 total. All that totals 75 COVID patients, and that number continues to creep up day after day. 11 of those patients are on ventilators. The range of ages is from age 2 years of age, all the way up to age 88, with the predominant ages of growth being in the middle age to younger populations. Only 17% of those patients are from outside of Midland County. That's a common question we get. How much of this is the result of the border crisis or other factors that extend beyond our own community? This is a Midland problem. It is not being driven by people from outside of our own community. The Delta variant clearly is driving this new spike. We don't send out every positive test, but we were able to send out 24 per week for verification of which variant is involved. Those go to a state lab. They take a couple of weeks to turn around. But in the most recent batch, 96% of them were positive for the Delta variant. So we're highly confident that it is the highly contagious Delta variant that's driving the current surge and impacting us tremendously, not only here, but throughout the region. The census in the hospital, as you have seen over the past few weeks, has been growing. The growth rate is really pretty unsustainable. I would imagine someone will ask a question later on today about the recently published study from the University of Texas's Projection Center, which showed that really all over the state we're growing at an unsustainable rate. In the region that includes Midland and Odessa, the UT projection was far in excess of what our capacity is, over 500 inpatients projected by the first part of September. Those past projections have tended to be on the high side, but even if they're off by 50%, 250 patients plus in the hospitals in our region is an extraordinary number, and at least at, if not above, the maximum that we can handle. So we are clearly on a pace that is very troubling and probably unsustainable. Lab results tend to be a leading indicator of future hospitalizations, and we're continuing to watch the lab results that we do in our own centers and tracking those on a day-to-day basis. If you're interested in that information, it's available on our website. It's easy to see. We update it every day. But just to give you some examples, we have moved from 10% of the patients we test coming back positive to 27% in 5 weeks' time. In that same 5 weeks, our average positive number, the total number of new cases we find every week, has gone from 46 per week to 197 last week. And we're on a pace to be that many or more as this week closes out. Vaccination continues to be a concern. We'll talk about some more in a second. But in Midland County, we are at just short of 39% fully vaccinated. That's well short of the average in the state, well short of the national goal of 70% and the 60+% that most states in the union have achieved. We are at best a very poor performer in terms of getting our community vaccinated. Adding to that concern, we are expecting as soon as tomorrow, more likely next week, that the CDC and the FDA will likely recommend booster shots, a third shot for those of us who have gotten Pfizer or the Moderna 2-shot vaccine, especially for high-risk patients, people whose immune systems are compromised, who may be seeing some decline in the protection they received from the first 2 shots of the vaccine. So we're now beginning to plan, working with our Unified Command Team partners, to be prepared to return to a mass vaccination effort to get those boosters in the arms of the elderly and the vulnerable who are likely to be recommended next week. That recommendation has not yet come. Please don't ask for a booster vaccine at your local pharmacy or one of the hospital sites. Don't do that yet. We're not authorized to do that yet. We're expecting that it could come very soon. Meanwhile, there are lots of ways to get vaccinated, lots of places. Tassa is going to put up on the screen a list of the vaccination events that we have going on in the next few days. But remember that the CDC has a very useful vaccine availability tracker. It's very easy to find out where you can get a vaccine, and there are many locations around our community and most communities where a vaccine is readily available. It is free. Oftentimes you can get it on a walk-in basis. There really are no barriers to getting vaccinated if you choose to do so. The situation, as I've reported, has been dire here. We are finding that we have many people who are younger than they used to be, who are getting very sick and even dying. I told you about a couple of recent deaths. The last time I was here recently, just in the last few days, we've lost 2 32-year-old patients, one male and one female. And they had in common a number of things, but one consistent theme that we're seeing with virtually every patient that's hospitalized, virtually every patient that has died in the hospital, is obesity. Patients who are overweight across the board are at much higher risk of hospitalization and death from this disease, and are particularly in need of a vaccine. I'll emphasize that later a little more. But the most important takeaway is that if you have a body mass index of greater than 30, your risk level is very high for hospitalization and death. And if you have not been vaccinated, you should do so right away. The main takeaway that I'd like for you to have today is that we are at full capacity. We have turned away a number. I had notes on that a minute ago and I missed them. Transfer requests. This is, I think, an important gauge of how full we are. I think everyone knows that we serve, as does Medical Center in Odessa and other hospitals around the state, we serve as a tertiary referral center. The small communities and the small hospitals in those communities that surround us depend on us to take patients they can't handle, that need specialty care they can't provide. And that happens every day. We get transfer requests and we expect to meet those as often as we possibly can. Just to give you a frame of reference for how busy things are and how difficult it has gotten. The week of July 4th, just over a month ago, we had 34 requests for transfers in, and we had to deny 13 of those. So 38% of the requests were denied. Last week, the week of August 1st, 126 requests, so 4 times as many requests, and 114 denials for a 90% denial rate. We are full all the time, especially in critical care. We have critical staffing challenges, and most of the time we're unable to serve the needs of the people in our region who need us to serve as their tertiary referral destination. That's a critical part of our mission and our responsibility, and we simply can't meet it because of the COVID spike that we're incurring right now. So we're full. We've had some good news from the state with regard to staffing resources. I'm going to ask Kit to talk about staffing here in just a little bit, but we have big needs that we hope our state friends will help us with. We are recognizing that we have responsibility to find and secure as many traveling nursing and respiratory therapy and other staff as we can with our own resources. Those have gotten almost impossible to find and extremely costly as we are able to find them. And those prices keep going up and the availability keeps going down. Our local resources that we already have here have done tremendous work in trying to stay abreast of this new challenge. It's very frustrating. I was reading a long article written by an emergency room physician yesterday about the frustration of what appears to be a voluntary issue. You know, for months and months, our folks have had to deal with the consequences of a disease that we didn't have a lot of tools to fight. We certainly didn't have a vaccine. They stepped up and they did what they had to do because that was the right thing to do, and it's their calling as healthcare professionals. In the current surge, it feels more and more like the people who are in the hospital have chosen not to be vaccinated, and so they've chosen not to take the action that could have prevented their hospitalization, their severe illness, and even their death. And that's much harder for caregivers to deal with. They're still doing it. They're still bound by the oaths that they take and the responsibilities they carry as professionals, but it gets harder. Morale gets more difficult day after day when we see the evidence of a pandemic that could be squelched, could be declining, and because of voluntary actions or inaction by our community, it's not. It's much harder for our team to stay the course. The last vaccination appeal. It is clear to me that there are people in our community who, for whom the appeal to be vaccinated falls on deaf ears. They have made their choice. They have used whatever information is available to them, good or bad, misinformation or accurate, to make decisions that they won't change about vaccination. And for people who are healthy, who are lean, who are young, that's a decision that they can make. And it probably won't impact the hospital. But if I can appeal to anyone, it's the patient out there, the individual in our community who is obese, who has hypertension or diabetes or some other chronic disease. Your life, your health is very much at risk today. And if you have chosen not to be vaccinated, you need to make a choice to get vaccinated for your own good, regardless of what you think about serving the community. The only way you're going to stay out of the hospital and stay well if you have those conditions is if you get vaccinated. Please do so immediately. If you're not clear on what it means to have a body mass index of 30 or more, it's not that difficult. I've said this before, I'm 5'11" and 215 pounds, and I'm right on the edge. I'm a 30 BMI. I would be in that category, or anybody bigger than me, of needing to be vaccinated simply because of overweight issues. Other sizes at 5 feet 2 inches and 165 pounds, you're a BMI of 30. At 5'6" and 190 or greater, at 5'11" and 215, at 6'2" and 230. These are not huge body sizes, but at each of those levels and weights above that, the risk level goes up. And we would strongly encourage you to get vaccinated if you haven't already. Finally, if you're choosing not to be vaccinated, especially for those of you who are choosing not to be vaccinated, protect yourself, stay home, stay out of crowds, wear a mask when you go out. This virus is highly contagious in its current variant. And if you're not vaccinated, you have no protection. You would do well to stay out of every crowd. And the reason, it is very simple and very straightforward. This hospital is full. It is, there is no relief coming in terms of a decline in disease. And we want to be sure that we are here when you have an automobile accident, when you have a heart attack, when you need surgery, when all those things that are not COVID arise. Our ability to do those things is jeopardized by the continuing surge in COVID. And we can do something about it. If we can get vaccinated first and foremost, but if we choose not to be vaccinated, we can minimize our risk and do our best to stay out of the hospital. And please do so. Now, I'd like to call on Kip for a moment to talk about staffing, and then he'll invite Dr. Wilson to give a short health department report, and then we'll all be available for questions afterwards. Dr. Bredimus.
Thank you, Russell. So my name is Kip Bredimus. I'm the Chief Nursing Officer here at Midland Memorial Hospital. I wanted to speak today about the staffing situation. I know that's a lot of the questions that we get as to where we are as far as our bed capacity. As Russell mentioned, we are completely full at our current capacity, and that is, again, stretching our resources to the max. We do have very high ratios in our med-surg and critical care areas where we typically have lower, more manageable ratios. To mitigate these, we are doing several different things. One, with the patients that we're holding in our emergency department, we are trying to get additional staff. For that, we have multiple requests into the state. This will be our third attempt at staff requests for the state following the announcement from the governor. As of this morning, that is 62 individuals, that is 52 nurses and 10 RTs that we have an open requisition for. That is in addition to our own internal postings and external postings within travel agencies. We've again had to increase our rates to almost 4 times what we normally pay for a nurse in those positions, which again is a massive strain. And we are again competing against other facilities that are doing the exact same. So it does pose a very big challenge. I think one thing with the governor's announcement yesterday that there are roughly 2,500 individuals, nurses that they're going to be deploying across the state. That's not really a whole lot to go around. So we do recognize that being in our area, the metropolitan areas will most likely be prioritized. So help may be on the way, but it will still take some time to get here and probably not to the numbers that we have requested. So we are going to continue to do what we can to mitigate this. Again, offering our own staff incentive shifts to work extra, but getting everyone to recognize that the nurses, the RTs, all of our medical staff, we're tired. We've been working through this, and as these long shifts and higher ratios go, there comes a threshold where money isn't the question. It's really just the manpower and the willpower to continue to move on. So I think it's been amazing to see our team continue to rally, continue to be resilient, and just fight this every single day. Again, I'm up here pleading for mercy and kindness and grace as we continue to get through this. I know that we see a lot of comments, positive and negative, and if we could really just pivot more to the positive comments and supporting our frontline healthcare workers, with everyone knowing that we are doing the best that we can to alleviate this situation, and we are in it with everyone else. Our role in the community is to continue to help, and we will do so, but we are asking for help. To that extent, I have one other ask, and that is going to be if you are a registered nurse or a registered RT, respiratory therapist, and you have the ability to work, please contact our Human Resources Department. We are posting temporary labor positions as well today. So if you are able to pick up 1 shift, 2 shift, anything like that, please contact our HR department. We are interested, and we would like to talk to you about potentially coming in to help, even in whatever limited capacity you may be able to. So with that, I will turn it over to Dr. Larry Wilson. Thank you.
Thank you, Kit. I am Dr. Larry Wilson, Chief Medical Officer at Midland Memorial Hospital and the Health Authority for Midland County and the City of Midland. I'm going to start off with a couple of other numbers that highlight some of the points that have already been made. The health department is seeing 150 or more positive cases daily. Those are reported from all over the city at other sites other than just the Midland Health. You may recall that 4 weeks or so ago, we were reporting in the single digits, and we went up into the 50, 60 range. I think last week we were at 100, 120 or so. The surge is continuing, and it doesn't seem to be abating in any way. The health department has had a tough time staying up with their numbers because their staff had been reduced after the last surge, and they've had a hard time hiring up again. They have done so. They've hired up more staff, but it's taking a little time to get them trained up, but they should be able to get caught up and get back to contact tracing and doing the things that need to be done to keep you informed about the numbers and the information that's going on across our city and county. In the last 20 days, there have been 12 deaths from COVID reported in Midland County. Of those 12 deaths, 50% have been younger than 60, which is a significant change from what we were seeing in the earlier surges, and does reflect the number of persons that are over 60 that have been vaccinated compared to those that are under 60 that have not been vaccinated. Unvaccinated people are the ones that are getting sick, getting admitted, and unfortunately are dying. 1/4 of those 12 are 40 or are in their 40s or younger. So this is a younger population than we've seen with the other surges. And again, it reflects the unvaccinated population. There has been an increase in the number of vaccinated persons, or what we call breakthrough cases, that have been admitted to the hospital. And I think Russell made the point, there's 9 breakthrough cases in the hospital currently. Out of the 75 patients we have in the hospital, that reflects about a 12% admission rate, which is very consistent with the efficacy of the Pfizer and the Moderna vaccines, are about 85% effective. So this is not because the vaccines do not work. The vaccines work very, very well, but 15% or so of the people will get the virus despite the fact that they've been vaccinated. That's a very good vaccine, but it's still going to be seen. And with this the transmissibility of this virus and the amount of viral load we're seeing in the community, everyone's getting exposed. So you're either going to get it, or if you're protected, you won't get it, or you may get it and have an asymptomatic case or get minimally sick. But we're not seeing any of those patients that I mentioned, those 12 in the last 20 days that died. None of them were vaccinated persons. So once again, I'm going to emphasize that this is a disease, ongoing pandemic, unfortunately currently related to people that have chosen not to be vaccinated. This is an ongoing crisis related to not being vaccinated solely. That's the problem that we're seeing today. The modeling that was been mentioned, that Russell mentioned, is very sobering, very concerning. To think about a 4-fold increase in the number of patients in the hospital from the peaks that we're seeing now is not tenable. We cannot do it. Odessa cannot do it. Our community cannot do it. And there's no place to send anybody elsewhere in the state. We all have an opportunity to do something about this. If you choose not to get vaccinated for any misinformation or any reason that you choose not to be vaccinated, masking does help. Masking does work. The pushback that we still hear from people, why are you wearing a mask? They're politicizing this issue. Just remember, way back when we were all starting this process, masks don't stop viruses from being blown around. They reduce the amount of virus being blown around. They reduce your breath, water particles in your breath, from spreading into a wider circumference around you and exposing more people to it. So by masking and maintaining a distance from one another of 15 feet or more, as far as you can from one another, you can reduce the likelihood of the virus being transmitted from one person to another. You're not going to stop it, not with the Delta variant, but we can reduce it. And right now, it appears that we have this paradox going on where we have this huge surge going on, more than anything we've seen, unprecedented in anything we've seen with any of this process so far. And yet people are behaving like things are normal, and they're getting mad at people for not wearing masks. It's just really hard to understand. I'll just put it to you that way. So I believe those are the comments that I had to make. So I think Russell, I'll turn it back over to you.
Thank you, Dr. Wilson. Now, all 3 of us are available for questions, and we're happy to take them.
We have a question from CBS 7. Good morning. Question for Mr. Myers. Just for clarification, were you saying there is a 2-year-old that is on a ventilator, or a 2-year-old is your youngest being treated for COVID?
Yeah, I did not say on a ventilator. I said it's the youngest in the age range of those being treated for COVID.
We have several questions on Facebook. Oh, I'm so sorry, Mitch. I just saw your hand raise. We will, Mitch, go ahead.
Oh, thanks, Tessa. Hey, Russell, after hearing a recent briefing from Russell Tippin in Odessa concerning ventilators, how is, they're running low and they're buying more. How is Midland Memorial currently doing with its ventilator supply?
We have been blessed with an ample ventilator supply from essentially from the beginning. We made a large purchase with the help of a local foundation early in the process. So we have, as of this morning, we only have 11, have 20 available. Okay, 20 high quality ventilators available today. This has not been a huge ventilator use surge so far. Doesn't mean it won't get worse, but we're in pretty good shape so far.
And I guess this is, yeah, I'm just curious, are you urging, or is anyone like, Kit or Dr. Wilson, with the spread being so, spreading across Midland so rapidly, with it affecting younger people, we're seeing larger school districts go against the governor and actually require masks. And, do you think, and does your staff think that's a move that Midland ISD should do, since we are seeing so many younger patients?
We have spoken, as you've heard also from the school district, that we recommend the use of masks in the school setting, just like any other gathering, especially with the Delta variant present in the community. Whether that's to be mandated by the schools in defiance of the governor's order is not a question for us. That's a question for the school district to address. We think people should mask voluntarily in the meantime. It's sensible in a school environment. We know that social distancing is almost impossible. And so for those parents out there who can make the choice to have their children wear a mask, especially those who are under the age of 12 and can't be vaccinated, we think it's a pretty good idea. But we're not going to step into the school district's shoes with regard to the policy decision they need to make in light of the governor's order.
And I guess, y'all have been having these regular updates, and, previously, the county was on here, the school district was on here, is there any plans to almost revive the unified command, or is this just going from here on out, just going to be the hospital giving us updates on the COVID situation?
It's just kind of a day-to-day thing. We actually have scheduled another unified command team meeting for next week to talk about what our practice will be going forward, as well as any other policy decisions that make sense across the whole community. So we remain in touch with our colleagues at the city and the county. We're actively planning right now with the county for this likely mass booster shot event. So we're continuing to function as a unified command team, and I would imagine as the situation dictates, you'll see representatives of the other entities appear in these press briefings as needed. Still sort of a work in progress. Everything changes every day. So the most important thing is we continue to talk, and we're in conversation and coordinating with those entities still today.
Perfect. Thanks, yeah.
We have a question from Caitlin Randall. What has vaccinating at the West Campus been like? Is there a high interest since vaccinations resumed there?
Well, on a relative basis, we haven't had a high interest in a long time. At the very beginning of our process, we were routinely vaccinating more than 1,000 people a day. What we now consider to be significant interest would be 50 in a day, frankly. And I believe we had 58 the last time we had a Friday afternoon event at the West Campus. We do see a slow but noticeable increase in the interest and demand for vaccine. We're not just doing it at the West Campus. We're going to individual businesses and other sites. Very, very importantly, we're going to appear at the Rockhounds game tonight. This is Thursday nights tend to be well-attended ball games, and with the cooperation of the Rockhounds, we're going to have a vaccination site right there just inside the gates. So anybody who comes can get vaccinated if they need to be without an appointment. We're trying to make it easy for people, and we're seeing slow but steady increases in interest, but nothing like what we saw at the beginning, and nothing like what we need to see to move our community from the 39% to 60-70% where we really need to be. We've got a long way to go to reach those kind of coverage levels.
This question's for Dr. Wilson. Can you explain the science behind why obesity is such a high risk factor for COVID?
Not exactly, but a little bit. There's something called an H2 receptor that seems to be the binding site for the virus in our bodies, and it appears that obese people have more of those H2 receptors, are more susceptible to having the virus stick around in them. Also, just by virtue of being overweight, people's breathing is not as good as that in people that are not overweight, and their physiology generally requires more work just to maintain just at a normal basal rate. So when you get physiologically stressed, their bodies don't tolerate it well. So I think a combination of those factors play into it, and is the reason that the virus is hitting harder on the obese people.
We have a question from Facebook. At this point in the pandemic, are there treatments that can be taken at home to decrease the risk of hospitalization?
Get Dr. Wilson to come back up here and address that one if you don't mind.
Yeah, absolutely. I'll repeat it. With the current situation in the pandemic, is there something or treatment someone could do at home to try to reduce the risk of hospitalization?
The treatments that's a good question. I think, by and large, as we have seen with all of the surgeries that we've had, fortunately, the vast majority of people do okay. You don't need to be hospitalized. You don't need to visit a hospital in general. But if your respiratory problems become more severe, then obviously going to a hospital or just getting a pulse oximeter for yourself to use at home. I think they're about $20. You can purchase one into any pharmacy. And if your pulse oximeter is getting down below 94% or so, it's probably a good idea to check in with a healthcare facility or your doctor to make sure you're kind of monitoring how things are going. The only proven treatment for outpatient utilization for preventing hospitalization or from getting sicker is in those people that are getting more severe and are requiring oxygen. Steroid therapy has been used and been beneficial. Short of that, it's just the basic things that you would normally do: Tylenol for fever, resting, making sure that you're well hydrated, et cetera. So there's not any specific treatments. There's been a lot of talk about ivermectin, vitamin D, a variety of different other more or less homeopathic therapies, because there's been some studies here and there that have suggested some benefit. But all of those things have been shown to be not really factors. That study about vitamin D specifically, they were looking at a population that they were looking solely at vitamin D, but it was in a population that might have been malnourished for any number of other reasons. So a lot of covariates that might be playing into these things were not taken into consideration. And when it was looked solely at vitamin D in a more effective study, it did not show benefits. So you're going to read all kinds of things about all kinds of ideas that you'll hear some of those from a variety of different providers that are going to tell you, oh, this will keep you out of the hospital. I've seen 15 patients and none of them have been hospitalized. Well, those are small numbers. And in vast majority of the cases, people aren't going to be in the hospital anyway. So that's not really proving anything. And there's not been any proven therapies for outpatient cure at all. So oh, yes, sure. Thanks. So the one therapy that you should keep in mind is the Regeneron therapy, monoclonal antibody therapy. If you test positive and you are able to get to our facility within 7 days of testing positive, and you are over 50 years of age and or have any other comorbidities, obesity, diabetes, underlying respiratory problems, health issues, you are welcome to get treated with monoclonal antibody therapy if you screen in. So basically what you do is you go to our website and there's a self-referral form that you can fill out at Midland Health. I think Tasha can put that up for you. And you fill out that form and then somebody will contact you, check the boxes to see if you are a candidate. And if you are, you can get antibody therapy, and that has proven to be beneficial early in the infection. If you're later than 7 days, it's not going to be beneficial. So you got to get a positive test early, meet some of those categories, and get the treatment. So thanks, Rose.
Thank you, Dr. Wilson.
Are you still continuing elective surgeries, or are those stopped?
Elective inpatient surgeries have been suspended. So a patient who's having an elective procedure that we expect to require an overnight stay in a hospital bed, we have suspended those types of surgeries unless they come up as an emergency, and then those can be considered by our team in the operating room on a case-by-case basis. We have not yet suspended outpatient procedures. Certainly, we're not suspending emergency procedures. Outpatient procedures would be the next thing we would have to consider if we continue to find that our demands outpace our resources. It's not, I think there are probably people who believe that any nurse can do any job, and given enough time and training, that's unquestionably the case. But to take a nurse who works every day in the operating room or the recovery room and ask him or her to go work in critical care, that's not a practical solution. So if we shut down surgery or if we limit it, we can repurpose some of those staff, but only for activities that make sense for their training and experience. They don't necessarily solve our problem. So we're continuing to do elective outpatient surgery, all types of emergency surgery, and limiting the elective inpatient surgery for the time being. But we're considering that every day. As we see the demands for care go up, we really haven't taken any options off the table. That's all we've done so far.
Thank you. I have a question for Dr. Wilson. Could you explain more about the health department needs? Are they looking for contact tracers, or what are they looking for?
Thanks. Yes, appreciate the question. You can contact the health department to get verification on what the needs are. Contact tracers are one of the pieces that are necessary. They're also short on nurses. They could use people to help get shots on arms for vaccinations. They're not doing much in the way of COVID vaccination, but they are doing all the routine vaccinations that everybody needs. They've got have all the regular flow that they normally need to be managing, and they're understaffed to do that. Specifically, they need technical epidemiological support also, and that's requires some specific training. So thanks for the question.
Stay up there because there's a follow-up question to that. Is the health department working more hours like before?
To my knowledge, they have not extended their hours at this point.
Okay, thank you. If you have a loved one that has tested positive for COVID and you've been exposed, how long should you quarantine for?
I'm going to ask Dr. Wilson to come back and talk about that. I know that part of that answer is dependent upon whether you've been vaccinated or not, but Larry, could you amplify that?
Yeah, thank you. Yeah, I think that's a valuable question, because avoiding exposure of others to you is a very important piece of this. But those that are vaccinated, it is recommended that if you are vaccinated, that you can wear your mask, social distance, self-monitor, and go about your business really pretty much as usual. Now, that's early on information, and I want to emphasize that practically, if you look at what's going on now with the transmission of this virus and the ease of catching it, that you might want to be a little bit more thoughtful about that, because people are getting it whether you're vaccinated or not. And you may have also seen some of the information that in early phases after exposure, if one gets the virus, viral loads in vaccinated and unvaccinated people are about the same. But the important piece of that is that in the vaccinated persons, the level of the virus in their system drops off precipitously over just a few days. And that's not the case with those that are unvaccinated. So you can get it, but the antibody works in your body from the vaccine and lowers your viral load pretty quickly thereafter in 2 to 3 days, very significantly. So those that are unvaccinated, though, if you are exposed, you should stay out of the workplace and stay out of exposure to others for at least 10 days. I think the CDC is saying 14 days as well. But if you're asymptomatic, self-monitoring 10 days post, you're pretty safe to be back out in the community.
There's a tremendous amount of that type of information available on the CDC's website. It could be a little overwhelming because there's so much there, but you can get answers to those kinds of questions from the CDC at any time.
Thank you. This may be a question for Kit regarding nurses that maybe are in their last semester of training. Could they go ahead and start working?
Thank you. So for nursing students, there are some things that we are working currently with our interns. These are hospital employees that are in nursing school that are in their transition to professional practice, but have not yet gotten a license. We are pairing those individuals with our nurses to help in tasking, but as of this point, you cannot work as a nurse without an active license. So unfortunately, no.
Doesn't mean you can't contribute, but you can't work as a nurse without a nursing license. You can't get a nursing license until you finish nursing school and pass the test. So that's all pretty straightforward. And those are the rules we continue to abide by.
Do you recommend that indoor gatherings of 100 people with no mask requirements cease in Midland at this time?
Yeah, we haven't taken we haven't made any attempt to get out there and campaign on that issue, but the short answer to that is yes. If you've got an indoor gathering, and we know that there are really no gatherings happening in this community today where people are consistently masked. So I would say yes, that those events should be suspended, postponed for the time being while this variant is surging through our community.
Do you know any information regarding the CDC approving vaccines for those under 12 years of age?
We keep hearing about it. The CDC it's the FDA that keeps things pretty close to the vest. I think we expect it at any time, as well as the full approval, moving the Pfizer and Moderna and J&J vaccines from emergency use authorization to full authorization by the FDA. Both of those things should be happening, perhaps even within the next month, but they don't really give us a lot of lead time when they're ready to make those decisions. But I think in general, it's widely considered to be impending, at any time soon, but hasn't happened yet.
Of the 9 vaccinated in the hospital today, what is the age range and are they on vents?
Yeah, we knew that earlier. Did we have average age of 64 and we have 1 on a vent? Is that right? Average age of 64, 1 of those currently on a ventilator.
Sorry, where all in Midland can someone get a same-day rapid test?
Same day is in pretty short supply, as I understand it. There's a lot of places you can get a rapid test, but it tends to be next day turnaround. Vital Care, West Texas Urgent Care, we know can do same day turnaround, but it's not free. We are doing a limited amount of same day turnaround now through a drive-in testing site at the F. Marie Hall Center, or what we used to call the West Campus. So you can call 68 nurse and get scheduled for that. We may not get you in the same day because we have limited capacity. We're trying to expand that capacity now, but call 68 nurse if you need a test today. There's a decent chance. Yeah, you can also buy a retail kit. They're available at Walmart and other sites. Not quite as accurate as the things you would get from us, but still could be a valuable tool. So self-testing is a possibility available at some pharmacies.
If or when boosters are okay, do you know if it will be required to have the same brand? For example, if you got Moderna, would you take Moderna again or Pfizer?
Do we know that yet? I don't think that we know that yet. There's been some back and forth on mixed. Yeah, so suggestions early on are that it may be okay to get the alternative, but the rules haven't come out yet, so we don't know for sure. But there's a decent chance that it will be interchangeable.
How many days should I take off of work when I get the vaccine? I've been advised to take off 24 to 48 hours because the vaccine can make you sick. Is that true?
No, that's, for some people, myself included, when I got the vaccine back in January, I felt a little puny the next day after getting the second dose. It wasn't enough to make me stay home from work. Other people I've heard have had a little bit more severe reaction, have felt a little worse, but it's a case-by-case basis. I think you should be prepared to take a day off the day after you get your vaccine. But for most people, no. And you might be a little sore at the vaccine site. Yeah, you might feel a little fatigued the next day, but for the vast majority of people, those are not debilitating. And for those few who are, it pretty much resolves the next day. So.
What is your recommendation for kids in our community under 2 years of age who are too young for masks and there isn't a vaccine available for their age group yet?
Yeah, keep them home. I guess that's the best advice we can provide is keep them out of crowds, just like we're doing with virtually every other population that isn't or can't be vaccinated. If you can avoid exposure to just about anyone, unfortunately, vaccinated people can also be carriers and can spread the virus. So minimize their exposure is the best that you can do in the near term. And also recognize that even though there has been an uptick in the impact on children, still by and large, children are the least likely population to really get sick from COVID.
What other treatments are being pursued for those not able to or are not willing to take the vaccine?
What other treatments? Well, if you don't test positive, then we don't have a treatment for you. We talked about the monoclonal antibody therapies primarily for those who are 50 years of age or older. Otherwise, you're going to get the regimen of treatment that we've provided to people as they get sick, which is mostly the provision of oxygen. That's the predominant impact on your body, is that it reduces your lung capacity. And so we've given a lot of oxygen to a lot of people. But the better alternative is to not get sick in the first place.
Are you doing anything to compensate your current staff for the added workload to retain them and prevent burnout and resignations?
We have all kinds of new incentives. We've just added, Kit talked about some of them earlier, but yes, there are multiple different incentives, especially for people who are willing to do an extra shift, to work a little bit more. We're constantly finding ourselves short of the staff that we need to respond to the demands. So we've added compensation for people that will take extra shifts. At the beginning of this year, we paid every staff member a bonus for having gone through what we thought was a waning COVID crisis, and now we're coming up on the end of a second year of the COVID crisis. We'll consider other things that we can do to reward staff, but recognize that our resources are limited. The disease, especially early on, was devastating financially to the hospital as well. We've recovered from that and are actually doing pretty well right now, but the costs of staffing are skyrocketing, especially as we bring in contract staff. So we have to be thoughtful about maintaining the resources it takes to keep the doors open. And so we'll continue to consider new ways of rewarding our staff. We know they're going through an awful lot right now, and just the simple recognition of that fact, as Kit said earlier, support from the community, any kinds of shows of support. Please resist your urge to be critical, especially of caregivers. If you're inclined to be critical of people in general, especially on social media, please put that away for now, or target your invective at someone else. Our caregivers need every boost they can get to get through this very difficult time, recognizing the cavalry's not coming. The 100 FEMA nurses we had in the previous peak are not coming back. We're scrambling to get the next 10, 15, 50 staff, and we're hopeful that we can. They'll come at a much greater cost, and they're much harder to get than they were before. So, our staff are pitching in every day, recognizing that the help they really need is going to be slow to come, and that's just part of our reality.
As far as obesity being a high risk factor, is it the same level of risk factor for overweight children as it is for overweight adults?
Yes.
Is there a certain type of mask we should be wearing, and can we get them somewhere for free?
Free? I don't know about for free. They're pretty cheap now. Yeah, anything double layered. There are mask availability is really broad. If you're an Amazon shopper, it's pretty easy to search for masks, and you get 100 different options, and they're all fine. If you're not delivering, don't get the ones with a valve where it lets the airflow out, without any restriction. The idea is to restrict the droplet expelling from your nose and mouth. So almost anything works. If you're a caregiver, it's a whole different story. We're going to provide our caregivers with N95 masks that actually prevent the droplets from getting to the caregiver. But as a general person just walking around the community, virtually any kind of mask you can buy commercially would be adequate.
How and where can people go to get tested for the Delta variant?
Well, the Delta variant testing doesn't happen in real time. We are limited to 24 tests a week is that right?
I think it went up to 30 actually.
30, okay, well, it's a handful. Anyway, 30 tests a week that we send from the hospital to the state lab for genetic sequencing, which is effectively what tells you if it's Delta variant or not. But that's not routine testing at all. The routine testing is going to tell you if you're positive for COVID or not with a pretty high degree of accuracy, but you're not going to get a local Delta variant test.
96% likely.
Yeah, we could just tell you, I mean, based on the tests we've been sending out, I said at the beginning of my remarks, 96% of the tests we sent out in the last batch that's been reported came back positive for Delta. So it's a pretty good assumption that that's what you have if you test positive.
We have a question from Stephanie Douglas. Did you mention today how many staff in the hospital are out due to COVID or being exposed?
I don't think we talked about it. Have you seen a number lately? 14 yesterday. Numbers are not at the level we saw in the peak where we were seeing 50 plus staff regularly out, but there's few, and that's somewhat a testimony to the staff responding to the vaccine expectation. You know, we don't mandate vaccines for our staff, but 70% of our staff are vaccinated. And so that's just like it would in a community, is going to tend to keep most of our people from getting sick. And that's been the case.
Yeah, we got 14 out and 45 isolated.
14 out right now and 45 isolated. Meaning they've had a positive test doesn't necessarily mean they're sick. So much lower numbers than they were in the worst of them. And I think without question, a testimony to the rate of vaccination we've achieved within the workforce.
We have a question from News Last 9. What is some of the help that the hospital is receiving from the state?
Well, today, none. You know, we're hopeful that, what's that? High flow oxygen cannulas. Yeah, okay. So it's more than none. We've struggled to get an adequate supply because we have so many people on high flow oxygen. It takes a special cannula or tube to deliver the oxygen, and we've run short of those, and the state has helped us get those. But by and large, there hasn't been anything else that's come lately. And up until the governor's announcement of just a couple of days ago, the state's response to our requests has consistently been, no, we don't have any resources to provide you with. We're sorry. And one of the reasons they've used has been that federal funding has been delivered to states and counties, and there's sort of an assumption that funding is helping to fill the role that the state would have otherwise. We have been in contact with the city and the county, and we'll be talking with them about freeing up some of those federal funds that they've received. But as of now, as of right now, the state hasn't succeeded in giving us a lot of help here recently. Now, they have promised that they will. The most recent thing I saw was the state was looking for about 2,500 nurses statewide to be brought to caregivers across the state under state contracts through the state's coordinated efforts. So we're hopeful they'll succeed in that, but they have to find those 2,500 people, and they're searching from the same pool that we've been searching from here recently. So it's just much more difficult this time around. And what we don't have is the federal resource, the FEMA staff being drawn from the whole country. That is not in play at present.
We have some questions regarding the vaccine clinics in those locations again. So I'll put that up on the screen right now for you guys to look at. And I'll also share that on Facebook after this press conference. While that's going up on the screen, I do want to apologize to some of our Facebook users. As I was about to read some of these questions, they've disappeared off my screen. So after this is over, I'll go back and filter through and try to answer the questions that we did not get to. If I can find them. If you don't get an answer, please reach out to us. We'd love to address your questions and your concerns. At this time, that's all the questions we have.
Okay, we'll be back with you most likely this time next week. We'll continue to treat this day to day and week to week. And if we need to have more frequent briefings, we'll do that. If we need to engage others from the Unified Command Team, we'll invite them and do that as well. Stay tuned. We'll see you next week.